I don't get you in there.
Oh, well, it was going this way.
Yeah, we'll turn back this way. Yeah, I can see her.
Okay, okay.
I'm sorry. Right.
Excellent.
Thank you, man.
Yeah.
Right. So I just, I know, Heather couldn't be here today because of, family, medical issues, so, keep her in your thoughts and prayers. And of course, Senator Batch is dealing with, some legislative issues that are going on, you might have heard about on the news today. So, she couldn't be with us either, so it's just me. You just got me today, so. As the governor mentioned, now that we've gotten through the cell phone part of the executive order, and I think that we may have to revisit that once or twice if there are additional guidelines that schools want to put in place in the future. But we also want to expand to the other initiatives that were in the executive order that he signed for establishing this task force. And in order to do that work, what we've decided we want to do is establish some subcommittees. And so the executive order laid out that he wanted us to address student safety, student behavioral health, and student physical health. And so we're going to have committees that are going to focus on each of those areas. So the student safety one really focusing on the physical environment of the school, anything that we can do to harden the target, so to speak, and make our schools safer places to be. And then student behavioral health, really focusing on the mental health and behavioral health parts of school life that kids are a part of, and knowing that kids often interact at schools and making sure that we get the mental health part right. And then physical health, really focusing on the physical health of kids in our schools. And as the governor mentioned in his budget, he had included counselors and social workers as part of the budget that was proposed. And so similar types of things that we might want to look at in the future of what we think would make physical health of our students better also in our schools. So think about which of those three committees that you might be interested in serving on, and so that we can get your input on where we should place you in one of those committees. And so that will be coming up as the next part of what we're going to look at as a full council. So we got a lot of feedback from you guys after the first meeting, and the feedback that we got from you all was that you really liked the portion where you got to hear from students. You liked the part where you got to hear from other stakeholders. And so today we set up a stakeholder opportunity for each of y'all to hear from some stakeholders that are out there. And so we wanted to make sure that you had the opportunity to listen to some of those other stakeholders across the state and focus on that. So we're going to get a perspective from a school resource officer. We're going to get a perspective from a parent, a teacher, and to focus on each of those topics. And we'll have each of those people come up and kind of have groups that you'll each go to. And you'll have, there's a number on your folder that tells you which group you'll go to, which group you'll be a part of. And we'll go around to hear perspectives from each of those folks. We've also got Dr. Ellen Essex here today, who's part of our council, known Ellen for a long time, and she's going to present some data on the Youth Risk Behavior Survey that's conducted every couple of years in middle schools and high schools across the state of North Carolina. And so we'll get some of that data today and hear about how our students are doing in our schools across the state based off of their own responses on the Youth Risk Behavior Survey. And so excited about that opportunity. So in your folders, you've got a copy of all the, you got the report itself. You've got the executive order that kind of lays out the things that I just talked about as far as the student health and well-being, the charge of the executive order for each of us. And so if you want to learn more about each of those different areas I was just talking about, they're laid out in the executive order. And you've also got the materials that Dr. Essex Group is going to present today on their PowerPoint. So what we're gonna do is we're gonna have the four corner perspectives that I was talking about earlier. And so I'm gonna have, I think Elena's got each of the four people, set aside back there that are gonna be in each of the four corners. You wanna have them introduce themselves real quick, Elena?
Yeah, they're right. So y'all go ahead right here. You wanna just say who you are and what your role is? Go from there.
Good morning, everyone. My name is Sheldon Fafaria. I'm a student. I'm a rising senior at Enfield High School. Excited to be here today. Excited to talk to you all. Thank you for the opportunity.
Excellent. My name is Bess Creech. I am a parent. I have a rising senior and a rising freshman at Broughton High School. I'm also coming off as PTA president at Broughton. So I am happy to be here too.
Amanda Morris. I'm a teacher at Panther Creek High School and a coach of lots of things.
Good morning, everybody. My name's Sergeant Tom Brianzi. I work for the Holly Springs Police Department. I supervise the SRO unit. I also sit as a chair for the Coalition for Safer Schools of Wake County.
So thank y'all each for being here today. We really appreciate it. So what we're gonna have is we'll have a DPS staff member or one of the staff members for the committee that will be facilitating the discussions. And each of the four folks that you just all introduced themselves will be in one of the corners. One of the groups will be in one of our training rooms, but we'll have staff walk you down to that training room so that you can get their perspective also. And we'll switch every 15 minutes or so to each of the different groups so you can get each of the four perspectives. You can ask questions of each of the guests that are here today, give their perspective on what they think is needed as far as school safety. We thought this would be a good opportunity to kind of get you guys a full look at the picture from student, teacher, parent, SRO, to get all the different perspectives that are related to school safety. And then we'll have a chance at the end where you all can come back together, and we'd love to hear one thing that you each learned from your perspectives with talking to each of the members. So kind of think through what you might want to report out. We can have the big group itself will report out also. So if there's something that the whole council needs to hear, but we think this was a good way to get started and think through what are the next topics we want to cover as a council by hearing from some of the different perspectives. So I told you everything here. Missing my co-chairs. They're all right. So we will go ahead and start the activity. The number that's on your folder. You have a number that's on the outside of the front of your folder. That will be the group that you'll go to first, and the numbers are hanging around the room. So 3's over here, 4's right here, 1, 2, and 4 will go to another room, but we'll escort you down there. So if you'll move to one of the 4 numbers, and we'll start the activity.
They're my most comfortable.
Or for you to drop me at the door.
You didn't even have to remind me.
Hey, you know, I'm trying my best. Yeah, friends come with us.
Thank you so much for coming.
There it is. Where's my lawyer? How you doing? See, right?
Yes. And you can just take it out of the yes.
Yes, sir.
Okay. Sorry. I didn't share any. I never seen it. It has been a long time, yes.
That's great. Thank you. Questions. Y'all will all have the opportunity to ask questions after that. Just asking different questions. Make sure they know the do you want to introduce yourself?
Yeah. All right.
So that's actually.
When I think about it,
My daughters and
Rising senior for 1 year, rising freshman.
So I'm just 21. Teaching and coaching.
Very loud and proud.
PT up in PD the whole time.
When PTA stuff, like the elementary.
I had heard about it.
My phone is down. So I'm just trying to running as I can go.
But that's
Safety, including emergencies, things like.
Right around that, when I got invited to do this, because another lady couldn't, so I something interesting, you know, it's something different. So yeah, that's kind of where I started out.
You know, what
Probably know
what
where
if
it's
there's
located, ready to get to Spring Village. So I have a bank in the village.
I'm ready. That's what I tell all my students. I'm like,
I noticed that.
Thanks. All right, so we'll get started. The first question is, as a teacher, what do you see as the biggest concern student safety and
Now I just back in their head, like, how do we ensure that?
okay, and obviously I have that on here, so, our campus sits kind of back, but we have a lot of access.
I think that I'm.
I know we do have it, but it was much
Officers or, right, what if there's an emergency? And I know that works on kind of a practical level, like, well, there's like. You have to be able to reach your answers, something like that, but also logistically, like, if there's a phone going off, let's see how.
Making sure I get everything right then.
So just.
Okay. Everyone's big. Yeah. Oh, I got one.
Literally around our school.
3 minutes with my.
But
Yeah.
if somebody wanted to be spy, they could be in the
And maybe it's.
It's
You could really come to this apartment complex.
They're gonna break up and make a written student.
Students and
staff
staff.
on the committees. So I guess we're not.
I'll be through that part of it.
Do we know which street?
They have to go to the spot.
One can stay here. I have the students who are safe, student safety, go over that training. Okay. Have that one, sir. Also have your office reserve and the one to build it too. So we can
Only.
put 2 of you at the same time, just take one out. Or we can use your conference, whatever your preference is.
Okay.
If it's a larger group, then we can take your conference room, the smaller they can appropriate.
Okay.
There's a, so who said you can go in the training.
Okay, perfect.
Yes, sir.
Violence.
Maybe not actual gun violence, but of course gun violence codes, right, and anything that's happened, not accounting just throughout the country, but I just. The amount of it, you know, when you can see, when you can take out basketball, you don't see, like, you're not thinking about, oh, the hundreds of thousands of things that are every day, or just saying, I think another thing that I noticed is
Also as a parent.
sometimes, so I've only experienced one code red during my high school career, but I've noticed that sometimes a lot of information goes out to parents and those outside before.
My oldest was.
And I think that obviously kids are in common and bigger. But I think it's a little more helpful if teachers and students are getting the information as it's coming, as it's coming to the parents as well, because you know, when you're hearing stuff on your phone on the outside, right? Like my friend in Art down the hallway, probably but they may be hearing something from the other building in health, right? And it could all just be the things that students are saying, but kind of hearing it from administration, this is what's happening, like it's hard to see perspective, like when our quiz read, like there was 10 different things about what was actually happening, right? And I'm sure none of them were actually real. And I think when that happens, you know, kind of makes it here just a little bit worse, because you're like, well, what, you don't even know what's happening, right? I'm just knowing it. So I think that's another big thing, is when you're in a situation and there's a lot coming at you, you're hearing about on Snapchat, on Instagram, like everywhere, but you're not really coming back from that specific source. And especially for parents, like, it's hard to kind of course, we want it to be kind of help your children, it's hard to kind of do that, so they're like, as well. And so kind of getting that information, from the administration or principals, I think is helpful.
What kind of like messengers
Are emergency process? I think teachers would be the best, just because they're in the classroom with them, they kind of, they're, in my mind, they're the ones that should be most knowledgeable about what's happening, sometimes they're just left.
I just, yeah, all of them.
And it's boring, but, that's the easiest form of communication, right, you know, your email threads or however communication goes.
You all have any student led initiatives around safety in high school and middle school?
It's a great question. We have, I don't think we've had specific safety issue or safety led kind of movements. I know, you know, we've had walkouts before, with dress code and teacher pay and stuff like that, but we haven't necessarily had specific things surrounding student safety.
You're gonna help them.
There have been instances where administration asks certain students kind of like, they'll send out surveys or they'll do discussions in school, but there hasn't been kind of specific movement. And it's a question that I get a lot. So I do micro tours for NLEX, and so we see, you know, me and a couple other tour guides, see, you know, a bunch of student or rising freshmen and potential parents that might come to school, you know, once a week for multiple weeks throughout the year. And I think that's another question that we get a lot, is that with all the stuff that's on the agenda today, whether it be student safety, you know, mental health, or physical safety, those are all things that we get questions about, and so there's not necessarily a correct answer that we're able to give them, and I think that that's one thing that has been, students, or when parents
for helping us get people to, perspectives today. And, we really appreciate all the folks that came that, participated in that. And before we get to Ellen, I just wanted, if there's some burning, thing that you learned, in one of your groups, that you think is really important for the whole group to hear, I just want to give everybody an opportunity real quick. If there's something you want to throw out there, I know the SROs threw out a couple of good ideas of statutes we should probably look at, for some language, but was there anything that anybody else heard that you thought was something that we need to definitely make sure that we have on the agenda moving forward?
I thought when we were in with the SROs, they made a very good point about revisiting, in light of changes in the criminal justice agency. What issues would be appropriate for, SROs to intervene in, which issues would not be appropriate in schools, and also the level of training and experience statutory scheme for that. They emphasize the importance of that. I think those are very worthy topics of consideration.
Okay. Anything else that anybody wants to bring up that?
I thought it was really interesting in talking to both the student and parent when talking about emergencies or lockdowns. There was less concern about the policy or what was being implemented and more concern about how it's being communicated, the communication plan. And where students were not, the person that they were in lockdown with was their teacher. And often their teacher had less information than the students. Not a great feeling for a student, not a great feeling for a parent, feeling like you need to text your student to share the information because teacher does not have up-to-date information on what's happening. And so I just wonder if there is a best practice about how we're communicating during those type of lockdowns that might ease some anxiety from other people in the emergency and also maybe abate some of the fear about our cell phone policy. Because I know that was, a hesitation of community members and the parent community related to emergencies and wanting to be in touch with your student.
Excellent point.
And then from the student perspective, I appreciated him sharing the idea of a student-led safety commission, where it would give ownership to the students. A lot of times adults are coming up with these ideas and thoughts and policies and recommendations, but he reiterated the power of having the student voice at the table and support.
Good point. Anybody?
I think it might be helpful to look at some of the policies that are already in place from this group's perspective and see it. A lot of things I heard, I was like, oh, there is a policy for that. There is a policy for that. There is a legislation that supports that, but it's not getting to the people it needs to get to, or they're not hearing it. There could be some way that we could support that better, I think would be helpful.
Anybody else? Those are all really excellent. Well, I hope you enjoyed the activity, and I know I did. I enjoyed hearing from the different perspectives, and I hope that was useful to you all also. We're going to move on to the next item on our agenda, and that's Dr. Ellen Essick, who's going to come up and present the Youth Risk Behavior Survey data, and she's a section chief at DPI. And also I serve with Ellen on the Child Fatality Task Force, so we get to see each other a lot. So she's an outstanding ambassador for this survey and the data that's included in it. And I'll hand it over to you.
Thank you so much. So I'm going to give you kind of an overview of the data that we have, not all the data we have, some of the data we have that addresses some of these issues that we've talked about today. And you're pretty much spot on, but hopefully we can talk about some of this data and use data to drive our work as well. Because if we follow the data, I think we can get the answers that will help and support our students. So I'm going to provide some information about the Youth Risk Behavior Survey. And for some of you know a lot about this, and some of you may not know a lot about it. So I'm going to share just what this survey is. The Youth Risk Behavior Survey has been done since 1993 on odd number years with middle school and high school students. So we've been doing this survey for a long time. We have a lot of trend data. Now, some of our questions were newer and added later as things change, so the trends aren't as long for some of the data. It's conducted at middle school and high school levels
all the schools and classes that are chosen to participate are randomly selected. So we don't have anything, we send in all the schools in North Carolina and schools are randomly selected. Participation is voluntary, both at the school level, at the student level. The student could choose not to answer any question they didn't feel comfortable answering. Parental notification is required, and it's set up to be done in one class period. Since we've moved to online administration, it's done in a lot less than a class period. The students are very adept at using a computer and answering questions in a hurry. So it doesn't take very long for them to move through and answer the questions. And again, it's completely anonymous, so we cannot figure out. There's no way for us to figure out who answered a question in any kind of way. The priority health risk behaviors that we ask about in the survey, these are behaviors that contribute to the leading causes of mortality and morbidity among our students. That's unintentional injuries and violence, sexual behavior, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, inadequate physical activity, obesity, and then there's some other priority health issues that we measure from time to time. This is the only survey that gets data from the entire state that asks the questions to our students. So this is student data. Before you're thinking students lie, they don't. Actually, you've done enough work to figure out they don't lie. They tell us the truth. And sometimes we've done some work, and my colleague Les Bill, who pulls all this data together, is with me today. And sometimes we'll say, we'll find something like, oh man, that really did just validate. They're telling the truth. Students really do answer these questions truthfully. So let's talk about what's going on. And this is just an overview of some of the data, and I'll give you some specifics. This was from the 2023 Youth Risk Behavior Survey. We have completed the 2025 survey, but we don't have that data back yet. We're just now submitting that data in, and hopefully that will be back by the end of this year, December, early January. So what we've seen over time, cigarette smoking remains at an all-time low of 4%. That has come down over time. Not many students smoke cigarettes, and that's stayed that low for quite some time. Vaping has actually come down since 2019. And before you say I don't believe that, it's still high. There's still a lot of students vaping, but it has come down in that time. Marijuana use is lower than it was, 32% lower than it was in 2013, so that's come down as well. Alcohol use, 36% lower than it was in 2013. So that's come down among our students. And I heard somebody in one of the groups talking about that. Students actually are somewhat thinking about those things. Like in class, they drink water. They're not drinking that many sodas. They're really, water bottles have a lot to do with that. They can have them with them. But we have seen some changes in our students. Prescription painkiller use, that stayed about the same. It's getting a little bit better. And then bullying, there hasn't been a significant change in that. And I'll show you that number in a minute, in the last 10 years. So I'll start with just some basic stuff, and that's obesity. If you look at our total students who are obese or overweight, that's 31.2%. That's gone up since 2013, even though we put a lot of money and time into trying to reduce obesity. But part of that is we have to also look at all the social determinants of health that impact our students, not just whether they're eating well and being physically active. We have to look at the whole picture. If you look, you'll see that overweight went down just a little bit. But if you'll also look, you'll see that obesity went up. So those overweight students may have moved into the obese category to make that happen. The percentage of high school students who were physically active at least 60 minutes per day on 5 or more days in the past 7 days. If you look from 2013 until 2023, you'll see the blue line is North Carolina. That came down to an all-time low in 2021 of 34%. Now that was done that survey was done in a different time of year. We were right back from the pandemic, and that was the first time we had answered those questions. But then we saw an increase, a statistically significant increase in 2023, and I'll talk more about that in a minute. And you can see the U.S. average and where that stayed across that time. The percentage of high school students who did not eat breakfast on any day in the past 7 days. So, we talked about that, and I think one of the groups I was talking about students who don't eat breakfast, and we're just trying to get them to get something in their bodies. And I don't know the reasons for all of that. We were really concerned to see that go up even more as we've had more and more last chance breakfast, universal breakfast for all students. So it's somewhat that they don't have access, and somewhat that we've got to do a better job educating about the importance of eating breakfast. And that starts in elementary school, not just later on, but how important it is to have that breakfast. So this brings us back to the smoking question. The percentage of high school students who are currently smoked versus those who use an electronic vapor product. And if you look at the blue line, like I said before, from 2003 until 2023, we saw a significant decline in the number of students who are smoking cigarettes. But we started asking students in 2015 about vaping. And you'll see in 2015 and 2019, we went up to a high of 36% of our students said they were vaping. That has come down pretty significantly to 21%. But it's still very much higher. You have to go all the way back to 2009, 2008, 2009 to see kids that were smoking that much. So we've still got a lot of work to do when it comes to vaping products in our students. Percentage of high school students who experience physical dating. And this one's really disturbed us a bit, and we're trying to figure out how to address this. You look, that's always stayed about the same. And that was asked, being physically hurt on purpose by someone you were dating or going out with. And that has gone up. We didn't ask that question in 2023. We didn't have our data back yet. And that is on the 25. So we'll see if that changes any from 21 to 25. But that's a pretty significant increase. We also know that around 2021, during that COVID period, a lot of students, dates were more individual. You know, when you could be all together and you went out with a group of friends, you had a lot of kids together. But during the COVID period, if you did go out, you probably were just with the person you were dating. So that may or may not have had anything to do with it, but it's just a thought that we've been kind of mulling around on our team. Percentage of high school students who were bullied on school property. And you can see there from 2013 to 2023, we've pretty much followed the national trends on bullying, going up and down a little bit here and there. And then if we look at electronic bullying, it stayed about the same over that time as well. So this percentage of students who say they were electronically bullied. The percentage of high school students who got 8 or more hours of sleep on an average school night. And I heard our health living teacher talking about how little sleep students were getting. And you can see how that's gone down. 28% got 8 hours or more in 2013, and in 2023 it's down to 21%. But it has also followed the same trend that we followed nationally. And some of that also happens around times that cell phones come in. So if we look at timing on some of these, you can kind of not cause and effect, but we can see some associations there. Percentage of high school students who did not go to school because they felt unsafe at school or on their way to or from school. And this one's increased significantly too in North Carolina, much more than it has in the United States. And you can see those years that it's gradually gone up a little bit in 2023. We know two of our districts that were able to get individual data for their district, oversamples for their district, took this and then went and met with their local sheriff's department, their city police departments, and said, how can we start working on this together as a community? So it's one of those things, you take the data and you look from a community's perspective, not just the school, but it's going to take more than just the school to fix some of that feeling of unsafeness. So working together with all the community resources. So we talked about mental health. The percentage of high school students who felt sad or hopeless, sad or hopeless, they stopped doing their normal activities. So it's a definition of depression, if you will. And we saw that jump significantly. If you'll look, 2013, that was 29%, but in 2021, it went to a high of 43% of our students. We were happy, very happy to see in 2023 that started coming back down. Still got a long way to go, right? But really happy to see that move in a different direction. So I want to go back to physical activity for a minute. Remember I talked earlier about physical activity, and if you look at the blue line, we said the percentage of high school students who were physically active on 5 or more days of the last 7, or 60 minutes a day. And you'll see over time that physical activity came down. And as physical activity came down, percentage of students who were sad or hopeless went up. So much so that those two lines crossed. And in 2021, you can see there how far apart they were. 2023, we were really excited to see this. Physical activity went back up and sad or hopelessness came back down. So recently, the state board added a requirement for 10 minutes of 60 minutes a week for physical activity for high school students. Nowhere near where they need to be, but it's a start to get students moving a little bit more. It doesn't cost anything, right? Ask students to be physically active in school during the day for 10 minutes. Doesn't cost legislators any money. It doesn't cost taxpayers any money. It costs a little bit of time, 10 minutes a day. But I heard our parent talk about the fact that their kids need to be outside more. They needed some breaks during the day, so they weren't so stressed. And we believe that too. So I hope we'll see some results from this after a few years of implementing this work. And that's the other issue with all of these health issues, is that you don't do something one year and next year everything's great, right? You're gonna have to wait 5 or more years to see the trends move in the right direction. So we have to stay consistent with what we do. So going to suicidal behaviors, the blue, if you can't see the graph down here, the blue is seriously considered suicide in the last 12 months, attempting suicide in the last 12 months. Yellow is made a plan for suicide. Green is attempted suicide. And the gray is made a suicide attempt that resulted in needing in an injury that needed treatment from a medical professional. And you can see that each year, all of those rose until 2021. And then in 2023, we finally saw that moving back down a little bit, although the attempted suicide has stayed consistent. And that's also consistent with national data as well. But that's still a lot. 10% of our students attempted suicide. That's a lot of students in North Carolina public schools. So it's still an issue. Just because it's coming down a little bit doesn't mean we've got this taken care of. And this will give you a look at that by male, female, and overall. So the yellow line is the overall students who seriously considered suicide in the past 12 months. You see that we have a much higher rate of females in that time, and that went up in 2021 pretty significantly. And then gay, lesbian, or bisexual students, although that has come down in 2023, you can see the difference there, how much higher they are than their heterosexual peers. So again, a really high risk group to consider intervention. So the percentage of high school students who carried a gun, and this is set up by the total percentage is 5%. You can see at the top, and then you can see that broken out by different groups. And these were students on the question. They were told that doesn't include carrying a gun for hunting, because that sometimes we don't want to skew results by folks that they have guns at home for that. So 5% said they carried a gun, but I think the next question is the one that, and that's an example of how that's trended over time. The percentage of high school students who said it would take them less than an hour to get and be ready to fire a loaded gun without a parent or adult's permission. 30% of our high school students said they could get a gun in less than an hour. And some of the feedback I always get is, yeah, but my child knows how to use a gun safely. I'm like, they do, until that frontal brain says, I want to take my life. And then we want to make sure that they can't get one that quickly because they need more time to think about it, because they're very impulsive. So this is one that's really important in terms of thinking about our student safety when we talk about how to keep them safe over time. And you can see that and then the percentage of middle school students, we don't have a lot of middle school data here, but who reported it would take them less than an hour to get a gun. 2021, you can see that was 31%. That's gone up just a little to 23 and 32%. I mean, it's not statistically significant, but about the same amount both of those years. And you can see that by grade level, also by race and ethnicity. And then the percentage of high school students who strongly agree that they feel like they belong in their school. And you can see 21, 23. The total was 52% in 2021, 51% in 2023. And then you can see that by grade level as well. And this was an important one too, because school is we talked about that in one of our groups. The school is that home for so many of our students. And so for them to feel like they have someone that supports them in school is pretty significant. And we want to keep moving that number up. And the way to do that is to take care of our students and our staff. Because our staff deals with the same issues that our students do. And we need to make sure we provide plenty of staff wellness and support to those folks working with students. And the percentage of high school students reported they have at least one teacher or adult in their school that they can talk to. These are high school students. That's 62% in 2023. So we feel good about that. You know, the older students get, the more they go to their teachers and use their teachers for support because they're getting more familiar and they built relationships, more relationships over time. We've been concerned about female students because but that seems to be going up as well. Feeling more comfortable with someone in their school they can talk to. And that could be a teacher, that could be a counselor, or a nurse, or a social worker, that could be a janitor, that could be a cafeteria worker, that could be a front office worker. It's anybody that they make those connections with and have those relationships with in school. That wasn't the last one. So like I said, there's a lot of data. If you go to the NC Healthy Schools website, you can have all of that, or you can call Les Bell. Matter of fact, I think I'll just put his name up there and you can. But Les is happy to help you figure out data, look at data. Just a few things about it before you call, though. We don't have county level data, except for 5 districts that were oversampled. So we can't give you data about your county, for example. But we can help you with state data. And you can look at that over the trends over time if you want to see that. So we're happy to help provide. And there's more on each of those topic areas. There's a lot more. I only had 20 minutes, so trying to give you just a little bit of overview of what's going on. But I think for this group, to use that data to help drive our work is really important. What is the data telling us, and then what can we do to try to address some of those issues? So any questions on any of that?
When do you get the 2025 data? Or
Probably December. Usually we send it in, and then it has to be weighted and cleaned up.
People at CDC still have jobs.
And yeah, and if the CDC still has a job, the folks that do that for us will know. Yes.
I'm sorry, could you give there examples of policies or initiatives that have come out of this data, or maybe any that you're planning?
Well, the physical activity at high school came directly from this data. We saw this data and said, you know, if high school students say their mental health is better when they're being physically active, then let's give them an opportunity to be physically active. That's a challenge, but it takes a little bit of time out of instructional time, or it can, depending on how a school sets that up. So that's where some of that pushback comes, but the data was really clear on that one.
Related to your comment earlier, which is looking at policies that have been passed and thinking about best practices or how we're kind of sharing communication. Do you know ways that has been implemented, the 10 minutes a day in high schools, or like models of how it's been implemented well?
It hasn't been yet because it starts this year.
Okay. And do you think schools are aware of this?
As many as we can tell about it, they are.
Yeah.
We're sending out communication to them quite often. We've had several webinars to help explain to them how they could do it, give them different scenarios on how they could implement this depending on their schedule. And the other thing is trying to get them to say it's not a punitive thing to say you didn't do this time. It's rather, how can we help students be able, I mean, this physical activity for mental health is not about getting your heart rate up. It's about moving.
Yeah.
There's a difference there, right? You know, for obesity, we want your heart rate up and we want you to have sustained activity. For mental health, a few minutes in each class to move around. Somebody had mentioned putting stuff on the screen, a dance video. There's tons of free stuff out there that you can put. And we have a whole list of resources for schools as well that they can use to add that. So I'll tell you some examples when we get them back. But for right now, that is.
I just haven't heard anything about this yet, and so,
That's because it's just beginning.
yes, and so that makes more sense, and I'm curious how our district is gonna implement this, because we're going to a block schedule too, so.
Well,
So
so
we
we've had-
change, so it might actually be easier for them to implement it.
So the same policy has required 30 minutes of physical activity for K through 8th graders for the last 20 years or more. And most schools have figured out a way to do that. Sometimes you have to experiment a little bit, figure out what works in your school, but it's doable. And we often say include energizers within instructional time. You can do things that make people walk around the room while you're doing math problems. There's a lot of ways to implement that.
The walk-in classroom, I don't know if anyone knows. that
There is the
about
walk-in
that.
classroom if you can afford it. Yes.
Awesome if there was funding for that.
Yes.
I have a follow-up question about the marijuana use. Do you define, when students take that survey, do you define or include the use of gummies? Do you think they equate gummies with marijuana use?
I will defer to my data consultant in the back. I don't think they're asked about gummies in the
It's
question.
not specifically about gummies. So there's questions about vaping marijuana, smoking marijuana, but I don't think we have one about edible.
I just, from what I observe, have been observing, that is how students are ingesting or participating in marijuana use. And so it might be something to think about how we're positioning that question. I don't know if they think about that, because they're not smoking it,
They're ingesting it.
they're ingesting gummies.
We had, it does create huge operational disruptions for schools when kids potentially overdose because they don't even understand the dosage that they're consuming.
It's a good idea. Unfortunately, we can't change the questions. The CDC makes these questions. Now, I don't know, we can look in the book of questions and see if that's really not what you call it, the bank of questions, and see if they have a big book. We can look at the questions and see if they happen to have one. We only asked one or two about marijuana, but we could look and see if they have one that was more specific. I don't know, we'll have to check it out.
It's just a trend that I think is happening, and I don't know if they're equating that language with what they're doing.
So this year, I had to look back because our questionnaire does ask them in the past 30 days, how did you usually use marijuana? And choice C is I ate it in food such as brownies, cakes, cookies, or candy. So we will have some data.
So in 2025, we get our data back, we'll know. We can tell you how many of them said they did it that way. Thank you all.
Yeah.
Appreciate it.
There, any other, I know she already took questions, but are any observations from her presentation or from any of the things that we heard earlier that, folks want to kind of pull out? I'll pull out one, the data that she provided on the gun issue is one that we have definitely used over the last few years to start our NC Safe campaign, which is secure all firearms effectively. That data is showing that, 30% of kids can get access to a gun within an hour, a loaded gun within an hour. Is very disturbing. And I know one of the bills that the governor did speak to this week that will be reconsidered in the General Assembly is lowering the age down to 18 to possess a firearm and to get rid of the requirement to have a concealed carry permit. I think I'm hopeful. We believe that there is both bipartisan support that veto will stand because we have 18-year-olds that go to high school. And without a concealed carry permit, that is a very concerning issue as someone that has loved ones that work in schools. I think that is an issue that we can definitely all get behind. But if that data helped to inform the safe storage campaign that I know the governor has helped us with, but also we've had lots of local law enforcement, like local schools and public health folks get behind and help us with get that messaging out that, as a parent, yes, you have the absolute right to possess a firearm, but you also have a responsibility to make sure that doesn't get into the hand of your child that brings it to school. And so that's just one example of how that data has really helped inform public policy moving forward. But I think there's some things that we can definitely take from what she presented today, that can help us lead future discussions for this group about other policies we may want to look at or things that we may want to try to implement across the state. So any other things that you guys kind of picked up on from that data? If you want to make sure that we hit upon in the future. We're out already, I see. So we did the four corners so y'all could have some physical activity.
Absolutely.
I don't know about the donuts fitting in the wellness,
Healthy breakfast.
There's some good.
All right, we're gonna take a quick break then for 5-10 minutes. Let's see, what time is it? Why don't we come back at 11:45? So if you wanna go grab a snack or use the restrooms real quick, and then we'll come back and talk about the committees real quick.
We must have like some data I'd like to come up with our shot. School district should. Yes, they should. That's why I tell you that. I'm gonna get back to you. It may not be, every goal might not be driven by the RBS, but it comes at least one or two top of our goals come from that population.
Yes, sir, I know. Look, I'm gonna take a picture. Look, I told him what you said. He was like, oh yeah, I like it.
My brother, I always got his back.
Okay, I got you. Thank you.
Yeah, we're gonna do our health living coordinator meeting in Chatham.
Well, put the donuts for everybody, please. They don't need to stay here with me, please.
Our building, some of their like, what are our roles and responsibility training, like, administrators, we've been letting them use our, which is to do a great location with nice meeting space. That's free.
Always not, really. Always not. Thank you so much for everything. Yes, sir.
I wish I could do some stuff with the staff job. Thank you much.
You want me to be the, like, above all else, but one, it's an expertise in them.
I do the work.
Listen, penetration with that building or buildings. And if you wear it,
And my friends are like, and my friends are like.
Yeah, I'm curious.
Very well.
Photoshop is awesome.
It's not the same.
And that's sort of what I had to find out. It's not, it's very different. And it's hard to. It's hard at least right now, I think we're not turning away.
I was thinking, oh, I'll stop for breakfast. I'm like, wait, and I hadn't eaten well, I'd be like, no.
That's actually good. All right.
It's a different kind of 40, isn't it?
But it actually was like, it's the girls' life, and that's what's recognition, it's still hard, but still, they want you. Lots of person don't. You do, your own money. Yes. And our district doesn't reimburse. Yeah. I mean, sometimes I find grants that don't go anywhere for me.
Schools are not, and districts can still require. So you
Right.
can still require it. So you can go above and beyond.
No, it's still too cold. I'm sure. It would be nice to know if there was something in place, did she actually really employ more nurses in North Carolina? And if we did, then they're gonna stay.
Yeah, I don't know. The implication is that we don't have enough and this is gonna help us get more. I don't.
You would.
I don't think all the 2-year nurses are gonna, RNs are gonna run out.
I really
It's
did.
still working.
We were.
So I
thought it was
I know.
Yeah, but again, it was very nice weather. I don't know the guy, I don't know. Yeah, I get paid.
It's personal.
Trying to get a small break. Gotta make credits have been bigger. I got my eyes checked. The frames and lenses have shot up since the last time I got glasses on. But I need them. So.
Everything else.
Yeah, everything else is in place, right?
All right, so next we're gonna, look at dividing up into our subcommittees, and we've got them up here on the board, for your reading pleasure. But there are gonna be 3 subcommittees that I described earlier. The first one will be on student safety. That's really gonna look at, we'll consider, threats and violence to harm, gun safety awareness and building security. So if that's a topic that you feel like you have more expertise in and would like to focus on, that will be the student safety one. Mr. Casey Corey back there, he's got his hand raised, will facilitate that one. That one's gonna be in the, training room where the, school resource officers were earlier today. If that's the group that you would like to participate in, Mr. Corey is our Director of Education here with Juvenile Justice, so he'll help facilitate that conversation. We'll have the next group will be, student behavior health. That will consider support for student mental health and behavioral health, including how to support staff and best practices approaches to working on these topics. And so if that is the topic you're interested in, that's going to be Elena. You're going to do that one, right?
It's gonna be
Or that's going to be Brandy. Brandy's going to do that one. Brandy, y'all going to meet in here, right?
Yes.
Y'all can meet in the back there, and then, the other one is student physical health. If that one is the one that you're interested in, that's gonna consider how, we support student physical health, including issues, such as substance abuse prevention, healthy eating, and physical activity. That group will also, y'all wanna meet in here too, Elena?
Yes, sir.
Okay, and y'all just meet up at the front half of the room, if you wanna do physical health, so physical health up here. Behavioral health in the back, and then school safety or student safety will be in, the training room that we were in earlier with the law enforcement officers when we were doing the breakout sessions. So what is your commitment by joining this committee, these subcommittees? The good news is We're not gonna meet outside of these meetings, all right? So we're not asking you to go to any more meetings besides these. This will be, during these, advisory council meetings moving forward, we'll have time for each of these subcommittees to break out. And then those subcommittees will come back to the big group and help, report out, policy decisions that we want to consider as a full, advisory group. And the reason why we're doing this is we thought that would make it kind of a little bit easier to organize in small groups. But you guys, that seemed to really work well when we were doing it virtually with the cell phone policy that you guys were much more talkful, if that's a word, loquacious when you were in the smaller groups. And so we thought that would give you opportunity to really kind of speak up and give your input in those different areas. So you're not committing to anything outside of the normal meetings. This will be just producing materials while we're in the meetings here and then coming back to the big committee and reporting out. In your packet, in your folder, there's a committee worksheet that you guys will go through today. You may not go through the whole thing today, that's okay, but this is kind of just the kind of start to the discussion. Based off of some of the input that we got today, when you're going around to the four corners, you should have heard each of the participants today kind of answer these 3 questions about these different subcommittees. So you can base it off of some of the stuff that you heard from there, or also your expertise. That's why you're here, is because you're an expert in these topics. And so we want you to give your input in those different areas. We'll spend 30 minutes on this, and then we'll come back together and report out anything that you guys have come up with today. But again, this is just kind of getting started today. And then when we come back, we'll just have a couple minutes just to wrap up and adjourn for the rest of the day. So if you'll get in your subcommittee groups. Yeah.
Hey, Billy, just to deconflict us, like usually behavioral health means mental health and substance abuse. So does here we want to put substance use in with the physical health?
For this conversation, we're going to do physical health. It's going to include substance abuse on this one. But yeah, you're right. A lot of times they are co-located together. So the behavioral health is really going to be focusing on more of the mental health issues like suicide and anxiety. I know that the student that was here today told us a lot about the anxiety of applying for college and those types of things. So those issues that are around mental health. Other questions people have? Is it clear? And we decided we would let you go ahead and self-report which group you wanted to go to instead of forcing you into one that you may not want to go to. So,
Would like to come student safety, you can follow me. For our guests in the room, if you want to join the subcommittee, feel free to join in where you would like.
I have to put it on the document.
Okay, we got everybody back, I think, and so we're just gonna report out real quick on anything that you think, came out of the discussions in your subcommittees. And I'll start with the student safety one. Anybody from our group wanna speak up and kind of mention anything that we thought a lot? Anybody wanna, highlight one or two things that, you think would be good for the whole group to hear? I'll be sure.
One thing, we have a very interesting discussion. One of the things we came to that maybe other groups came to too is that there are many subjects within what we talked about that could also overlap into the other two committees that we're meeting at the same time that probably need to delineate pretty carefully the procedural matter, who's going to cover what specific parts of some of those subjects that could unnecessarily overlap.
How about student behavior health? Anybody want to mention one or two things that y'all talked about? I see heads just nodding. Like a circle here.
I'm happy to do talk a little bit about what's currently what's the standard currently in place around everywhere. What a lot of our conversation came back to resources, and so what resources we want fiscally, as well as like community support and resources. But then we also came to the question at the end around and what could be done without those resources. So who do we want to learn from? What subgroups do we want to hear from? What communities and people who are doing things really well do we want to hear from to be able to create recommendations? Some that of course will include money, but some that also may not include money as well. Yeah. Okay. Good job.
All right, and then finally, physical health. Anybody want to speak up for physical health? I don't know who all was on which committee, so I don't even know who to look to.
I think we talked about a lot of ideas, a lot of different things, but also about thinking about bang for our buck. What are the big things that we have some possibility of moving through this group or working toward through this group? There's a lot of small things we could do, but we've got this conduit to the governor. What can we do in this space to help make some changes?
All right. Well, what we'll do is we'll take, I know each of your groups were being facilitated by a staff member. They're going to take, they took notes, and we'll get all those notes back and then kind of let that lead us in the direction of where we should go next as an advisory council. If there are other things that you think of on your drive home, I'm sure that something will pop in your head that you were like, man, I should have said that. You can send that in to us. You can either use the main email address that's on the website, or reach out to Elena or myself, and we'll be glad to get that included in the upcoming agendas as topics to cover. I know in our group, we had several presentations that we were interested in seeing from some experts. So we'll definitely take that input that you guys gave today and make sure that's included in upcoming meetings. I know I do want to just thank each of you again for the help that you put together on the best practices guide. It is really unprecedented that you get a report out in 2 months in state government. And so that is almost a miracle. And so I appreciate all the work that you guys put into that. I want to thank my staff that worked really hard on it. And Elena, I mean, she's amazing. And so thank you so much for all the work that you did to make that happen. We will send you out details about the upcoming meetings that are coming in the next few weeks. And so that you know when those are coming. Several will be kind of keeping on the cadence of that you saw moving forward. And I've got my agenda all out of sorts here. So do you know this? Yet know when the next one is, Elena?
Up there, September 29th.
Oh, perfect. There we go. September 29th is the next meeting from 9 until 11:30, and we'll get more details about that to you very soon. Any last thoughts before we close up? All right. Thank y'all so much. Thank you for your participation today. We appreciate it.
Thank you.
That would be helpful. Yes.
Yes, we do.
Thank you.
Okay.
To you as well.
I meant to mention that. Thank you.